Sam. I'm going to be your student nurse today. I'm just here to do a head and neck assessment on you, if that's okay. Okay, so I'm going to wash my hands really quick. So if I could get you to tell me your name and your birthday.
Kenna Davis, 12/31/96.
And do you know where you're at right now?
The doctor's office.
And do you know why you're here?
I have a checkup.
And do you know what today's date is?
The 23rd.
Okay. And how are you feeling today?
Good.
Okay, so the patient appears to be awake, alert, and oriented. So I'm first going to start by just looking at your fingernails, and I'm going to be checking your capillary refill in all 10. And this one. Okay, and it's less than 3 seconds, which is good, and no clubbing was noted. And I'm going to check your skin turgor really quick, and no tenting, and your skin is pink, dry, and intact. Have you noticed any changes with your skin lately?
No.
No? Are you taking any medications right now?
No.
No? And then how about your hair? Are you noticing any texture changes, or is it falling out? Or
No.
No? That's all good? Okay. I'm going to palpate your scalp really quick. And the rest of your head. Alright, and your head is normocephalic. And so now I'm just going to feel your lymph nodes, if that's okay.
Okay.
And so we're going to feel the post-auricular lymph nodes and the periauricular lymph nodes. And then we're going to do the post-cervical and then the anterior cervical. And then we are going to do the tonsilary lymph nodes. And then we're going to feel your supraclavicle lymph nodes and your infraclavicle lymph nodes. And then we're going to move to your submandibular and then your submandibular. Okay, and now I'm just going to palpate your sinuses, your maxillary, and then your frontal.
Okay.
Okay. Next we're going to move to your ears. So I'm just going to identify the structure of your ear really quick. And we have your helix up here, and then your antihelix. Then we have your tragus here, and your antitragus, and your lobule. And then I'm just going to palpate your mastoid. Good. And then if you could just turn your head towards me a bit. I'm going to
go this way.
Sure. And I'm just going to look inside of your ear really quick. Pull the pinna up and back. And I'm identifying the umbo, the inca, the malleus, and the cone of light appears to be at 7 o'clock. Next I am going to test the whisper test. We're going to do that.
Okay.
So I'm just going to whisper some numbers in your ear, and then you'll just have to repeat back to me.
Okay.
7, 8, 9.
7, 8, 9.
2, 4, 10.
2, 4, 10.
Perfect. And that was testing cranial nerve 8. And so now we're going to test your cranial nerve number 5. And so I'm just going to have you move your jaw back and forth for me. Good. And then just tell me where you feel this cotton ball, okay?
Okay. Forehead, cheek, chin.
Good. Okay, and now we're going to test cranial nerve 11. So if you could just push up against my hands and then move your head back and forth. There you go. We're going to move to the eyes next, and to test cranial nerve 2, we would use the Snellen chart, but we already did that in the previous exam.
Okay.
And so now we're going to test cranial nerves 3, 4, and 6.
Okay.
So just follow my fingers.
Okay.
And now we're going to look in your nose really quick.
Okay.
So if I could have you tilt your head up. Good. And I'm just locating the middle and inferior turbutine. And while your head is up, I'm just going to look at your trachea.
Okay.
And I'm identifying the symmetry and palpating your thyroid. Looks good. And then I'm gonna ask you to close one nostril for me,
okay.
And then I'm gonna hold this and just tell me what you smell. Okay?
Okay. Lemon.
Good. Okay. And now we're going to move on to your mouth. So if I could have you open your mouth and say "ah" for me.
Okay.
And stick out your tongue. Good. And I'm identifying that her tongue is midline and symmetrical, and that her uvula is midline as well. And to test cranial nerves 8 and 9, I would have her open her tongue, and I would place the tongue depressor in the back of her throat and wait for her gag reflex. And that was for, I meant cranial nerve 9 and 10.
Okay.
And then to test cranial nerve 12, I'm going to have you stick out your tongue and move it from side to side. Good. And I'm just going to take a peek at your cheeks really quick. So her buccal mucosa is pink, moist, and intact. Perfect. Thanks, Ken.
You're welcome. Good job.